Thoracic spinal cord rejuvenation. Stem cell therapy for spinal cord injury recovery. A spinal cord injury is a heartbreaking condition that derives from trauma in the spinal cord, causing motor and neurological issues lasting a lifetime. The management mainly focuses on stabilizing the site of injury, stopping any further damage, and providing the patient for a possible functional recovery. This report explains how stem cells derive from other areas in the spinal cord so they could potentially regenerate and repair the damaged neural tissue in the thoracic spinal cord area. The replacement of the damaged cells could restore functions such as movement, sensation, and independence. Using neural stem cells for recovery. Neural stem cells can have the ability to differentiate into different types of neurons, glial cells, and other nervous system elements. NSCs, neural stem cells, can be used to regenerate or repair damaged tissue in the event of a spinal cord injury. In this study, damaged nerve cells are replaced or repaired by NSCs, in this case NSI 566, injected into the spinal cord, which may restore lost functions like motor and sensory roles. A chronic thoracic spinal cord injury is an injury occurring for over a year, affecting T2 all the way to T12, and often affects loss of function in the lower limbs. The techniques used for repair. A stem cell transplant for a spinal cord repair is a technique that transplants stem cells from a non-injured area into an area of damaged spinal cord, being directly injected. What scientists believe is that the stem cell differentiates into the specific type of cells needed to repair the damage. Specifically, in this case, the neural stem cell NSI 566 was used to hopefully become neurons or glial cells to regenerate the function of sensation or movement. The clinical trial. To see if their hypothesis was correct, they conducted a clinical trial including 4 patients who have a chronic thoracic spinal cord injury. The patients received a neural stem cell transplant from a healthy area of the spinal cord to the injured area. They injected this with the goal to heal and improve the patient's overall neurological function, while testing it with a phase 1 clinical trial, mainly focusing on the safety and tolerability of this procedure. Neurological function was observed before and after the treatment. Both the existence of adverse effects and improvement in certain functions were reported, and the patients were continuously observed to evaluate the transplant's long-term effects and safety. These subjects did show improvements in their motor and sensory abilities. In this photo, it shows us the process for the clinical trial. So in the first box, it shows the screening. So 10 patients were included. Men and women had to be 18 to 65 to be included. They had to have the injury from 1 to 2 years, and it had to affect T2 to T12. They also had to have a confirmation of a CT bone fusion and agree to a 5-year follow-up. To be excluded from this, they could not have a penetrating trauma, a spinal cord transection, a mass 2 centimeters in length or longer, an autoimmune disease, or unstable medical conditions. But there were 4 that were selected for this. They ranged from 25 to 35. There was 1 female and 3 males, and they had 6 injections each into the damaged spinal cord tissue area. They were in the hospital for 6 to 8 days and then had a follow-up every 6 months for 5 years. So during the clinical, they were asked pain questionnaires, and they were asked about their quality of life, and they did have an examination of their spinal cord injury. They also had a brain control motor assessment done, and they had an MRI imaging done. And in the photo up here, we can see them injecting it into the affected spinal cord injury, the area that was damaged, and then below we can see the frame that they used to see everything. Now, obtaining the results for this. The study wanted to conclude if it was safe and feasible if patients with chronic thoracic spinal cord injuries can be helped by neural stem cells, and is it a safe and practical therapy option that can improve neurological function. When the research was completed, they discovered the stem cell transplantation was successful with no major side effects. Only 2 out of the 4 showed a huge amount of progress in their neurological functions, which shows science that stem cells can contribute to the tissue regeneration and recovery. The challenge and potential of stem cell therapy for spinal cord injury. Now, there were some limitations to this, like the sample size was quite small considering that there are millions of people with this injury, but besides that, I completely agree with everything that they stand for and what they're doing in this therapy. They are improving lives every single day, and even though there was only 4 people involved in this specific clinical trial, I believe that as time goes on and research continues that we will find better and more practical therapy options for this type of injury, and maybe even other spinal cord injuries and beyond. Now, advancing stem cell therapy. All of this research will help the advancement of stem cell therapy, giving us potential treatment options and an understanding of stem cell plasticity. Stem cell plasticity is when cells have the ability to differentiate into specific cells needed for repairing and recovery. As they continue, the research future clinical trials will occur to truly understand the treatment's effectiveness as well as refining stem cell technology, exploring the best course and how to enhance the integration into the spinal tissue.